Today's topic of discussion, Parkinson disease, also known as PD. Parkinson disease is the neurodegenerative disorder. Okay, this one is the neurodegenerative disorder in which dopamine producing neuron. So PD is a chronic progressive neurodegenerative disorder characterized by slowness in the initiation and execution of movement. So it affected that movement. Example, bradykinesia. What is the meaning of bradykinesia? Slow movement and speech. Then increasing muscle tone, rigidity and tremor at rest. Tremor means nadukam. Okay, tremor and gait change, walking changes. So it is a chronic progressive neurodegenerative disorder. Slowness in that initiation and execution of movement. Bradykinesia means slow movement and speech, increasing muscle tone, tremor, nadukam at the rest. Okay, and that gained change, walking changes. Then it is a neurodegenerative disorder we know. So, okay, this one that dopamine producing neuron, brain structure, brain called that substantia nigra. Substantia nigra. Brain structure called substantia nigra are damaged and die over time, leading to number of motor problems and mental disabilities. This substantia nigra is part of basal ganglia. So it is a part of basal ganglia. What is basal ganglia? It is a group of subcortical nuclei, responsible primarily for motor control. What is the main main function of basal ganglia? This one is the group of nuclei responsible for motor control. So whose major function is to inhibit unwanted motor activity. This substantia nigra is the part of basal ganglia whose major function is to inhibit unwanted motor activities. When a person intends to make a movement, this inhibition is removed by action of dopamine. So a person intends to make a movement, this inhibition is removed by that action of dopamine. As this dopamine, this neuron are progressively lost in PT patient. That neuron is progressively lost in PT patient. So low level of dopamine make it harder to initiate that voluntary movement. Low level means very hard for movement. So this event leads to neuronal cell death. So because of that movement, it leads to this event, that low level of dopamine. This event leads to neuronal cell death. This one name is called as Lewy bodies. Okay, Lewy bodies, LEW. So low level of dopamine leads to harder to voluntary movement. So this one because of neuronal cell death, this one leads to that condition name is called as Lewy bodies, LEWY, Lewy bodies. So dopamine producing neuron, okay, that substantia nigra damaged means, okay, yeah, that neuron entirely affected. Okay, neuron entirely affected. So this one dopamine This one is the receptor. Here a receptor is presented, means normal person dopamine will secrete, that receptor is presented, so it will bind to that dopamine receptor. After that, that movement will occur. In the case of this PD patient, dopamine will releasing, but here for this PD patient, that receptor is lost, that neuron, dopamine producing neuron is damaged, entirely damaged. So here receptor is lost in PT patient, so low level of dopamine only. So here that movement is very hard, so harder for voluntary movement. That dopamine receptor, where is it is presented in central nervous system, it is presented, this one is damaged in PT patient, so very hard for that movement. So it causes two type of symptoms, motor symptoms and non-motor symptoms. Motor symptoms, we know that bradykinesia, that walking and speaking is very slow, then increased risk of falling, then speech changes are very difficult, then swallowing also very difficult, slurred speech and reduced facial expression. In the case of non-motor, this condition, it will causes constipation, urinary problem. These are the condition. Then later stage, it leads to mood and behavior changes. Then it will affected sleeping also, so it leads to sleeping disorders. Next, Parkinson's disease. PD. What are the causes? Two type of causes. One is genetics, another one is environmental factors. Next one is treatment. No cure for PD. Okay, no proper treatment, no cure, but current treatment are effective in managing motor symptoms. First line treatment involved medication which aim to increase dopamine level. So main aim of treatment to increasing dopamine level in the brain. So major classes of medication include levodopa, that medication L-tofa. Medication name is called as levodopa. Then precursor of dopamine, that levodopa can cross that blood brain barrier and is converted into dopamine inside the brain. Levodopa is the most effective of all medication, but because it also produces dopamines elsewhere in the body, its side effect may become seriously in long term. Along with the other drugs will take that levodopa inhibit its action outside the brain. So along with the other drugs will take that levodopa inhibit its action outside the brain. So taken with carbidopa. So along with this levodopa will take carbidopa. Then people do not responsible for medication. Okay, so surgery may be recommended. Surgery, T brain stimulation. So here the implantation of device called neurostimulator, which sent electronical impulse specific part of that brain. So specific part of the brain, it will send that electronical impulse. By using the device, the brain activity. Okay, so by using the device, control brain activity to relieve symptoms. So what are the treatment? We want to increase the dopamine level, so we will give that levodopa for inhibiting that side effect. Along with this levodopa, we want to give this carbidopa. Suppose patient do not respond for medication, means we will do surgery. Here implantation of device, the device name is called as neurostimulator, which send electronical impulse to that specific part of that brain by using the device control brain activity. So in this video, Parkinson disease PD we discussed. In this one, that neuron fully affected, dopamine producing neuron affected, so neuron that dopamine not bind with the dopamine receptor, so it will affected that movement. Normal person, dopamine bind with receptor, we have normal movement, but in the case of PD patient, the dopamine will releasing but receptor not accepted, because of that one harder for movement. So low level of dopamine, this will affected neuron cell death. That condition name is called as Lewy's bodies. Then symptoms, motor symptoms and non-motor symptoms, then later stage, then causes, genetics and environmental factor. Treatment, first we want to increase dopamine level, so avoid that side effect carbidopa. Then patient not responsible means surgery. Thanks for watching.